Hi everyone, Angela Carr here, and Nurse Maggie up above me here, my Maggie cat. She's taking good care of me. Um, I'm back home. This is day 2 after my hysterectomy. I wanted to pop in and let you all know how it went. And, my purpose here too is to help anyone who has a disability and has any issues, particularly with bladder and bowel issues, prepare for hysterectomy. I'm going to tell you about some choices I made, some mistakes I made, and how it all worked out. I am going to warn you that this could be a medical trigger for some folks if you've been hospitalized and had any PTSD, any medical trauma. You might not want to watch this. Also, I am going to talk a lot about bladder and bowel issues. So if you don't want to hear about that, you might not want to watch this. You can skip to the next video. So to give you some background, I know that because I have spina bifida, I admittedly don't drink a whole lot of water because I have bladder issues and I work full time. And typically I get Botox treatment every 3 months. I get Botox injections in my bladder. And they were doing the Botox injection this time after my hysterectomy. I had a gynecologist and a urologist working with me. And you know, as I get towards the end of my 3 months, I have to go to the bathroom a lot more often. And so, because I work full time, I don't drink the water that I should. So, I'm not as hydrated as I should be. So that did cause a problem with me when I went in for my surgery because they had a really hard time getting an IV in me. And I walk with crutches, so I asked them to put it in my right arm because I use two crutches, but the one on my left side I really need that one. I can walk with just the one crutch, but I have to have it on the left side. So I thought my right arm would be better. So they poked me about 5 times in my right arm. You can see all my bruises here. But so they poked me about 5 times, and then they got an ultrasound machine, and I actually had to use the ultrasound to find a good vein to find, and then they ended up having to switch to my left arm. So, and they got an expert, somebody, the expert that they had on dealing with difficult veins was, of course, in surgery at the time, but once he finished up, he came down and he did it with the ultrasound and got a good spot on my left arm. So IV finally went in. And they told me I need to drink more water. So I think I had left work on Tuesday and I was drinking water on Wednesday because I was thinking about it, but I really should have probably started like a couple of weeks earlier with drinking a lot of water. So lesson learned there. Make sure you stay hydrated before you go in for any kind of surgery. Um, so my surgery was really late because I'm in Philadelphia and one of the hospitals in this area is closing. So the hospital was really swamped. So I got there at 9:30 in the morning and I was in pre-op and I was just waiting and waiting and I think and I might even be wrong on the times, but it was like late afternoon by the time I finally went into surgery. Um, and then I woke up about 8 o'clock at night. I remember that I was in recovery by 8 o'clock at night. And I talked to the doctors before my surgery, of course, both doctors, the gynecologist and her team of doctors, and the urologist and her team of doctors, and the anesthesiologist. And I had told them because I self cath, I was worried about, being in pain and not being able to self cath for the night. So I said, let's put the Foley in. Let's keep, I asked them if we could keep the Foley in for the night because I was worried about, not being able to self cath. So they did that. Well, by the time when I woke up in recovery, actually I woke up, I was still in the surgery room because, like I said, the hospital was so packed. But when I woke up, I was in a lot of pain and not so much, I mean, I was sore from the surgery, but it was more that I had these bladder spasms. So it was like that. Do you know that feeling when you have to go to the bathroom so bad, like you've been trying to hold it for a while and now it's like hurting because you have to go so bad? I had that like every 5 minutes, like those bladder spasms, and that lasted for probably about 5 hours. That's really been the worst part of this surgery for me. And when I was in the recovery area, the nurse there was kind of nasty, to be honest. I think she was doing kind of like a tough love kind of thing, which doesn't work with me. She was being kind of tough on me, saying like stop moving around so much, and you know just breathe slowly, and that kind of thing. And I could also really see why people end up with addictions, after these hospitalizations, because she had given me fentanyl right after the surgery, which I knew they were going to do, but I knew like after surgery I didn't want any more opiates. So then when I was in recovery, and I know I was, probably getting on her nerves because I was crying and whining and all those things. And because these bladder spasms were really bad. But I was trying to ask her, she wanted to give me oxycodone. And I said, I really don't want any more opiates. Can you take the Foley out? And she said, no, because it was in the doctor's order already for the Foley catheter. And and I was like, well, I had actually asked for the Foley, so is it possible to ask the doctor if we could just take it out? Because I'd rather take out the Foley than be given more opiates. But she said no, and if you're in this much pain that you're crying, then you should have more pain meds. So she gave me more pain meds, which I wasn't happy about. I mean, one, I have addiction in my family, and I'm a food addict. That's my drug of choice, and I don't want to add on any more addictions. I don't want to risk any of that. And two, I know that opiates makes you more constipated, and I don't want to deal with that. I already deal with enough issues with constipation. So, but I got it then. And then they did let the doctor know, and they gave me some other medications that actually did help the bladder spasms. But they gave me a suppository, and then they gave me some more medications through the IV that was specifically for the bladder. And and I got that once I got into my room and I had the nurses there. Once I was in my room, the nurses that I had there were wonderful. They took really good care of me, and then eventually the spasm stopped, and I was able to go to sleep. And I think the last I remember was probably about 1 in the morning, where I was still complaining about being having these spasms, and I was finally able to go to sleep. So the next day, I talked to the doctors, and they said surgery went really well. Apparently, I have a uterine prolapse, which was the reason I got the hysterectomy. But I also had, I had fibroids as well, so that also was causing a lot of my pain issues. And so my doctor said it was good that I got it done, that in 6 months from now I'm going to be really happy that I had this done. And after the gynecologist took out my uterus, then the urologist pushed everything else back up. So my bladder, my rectum, I have stitches all around there because she pushed everything back up into it, where it should be, because everything was basically dropping. And so that should also help me with the bladder and bowel issues going forward too. I'm always going to have bladder and bowel problems because I have spina bifida, but I know that in recent years it's been getting a lot worse. So this should help me get a little bit more back to normal. So I'm really, happy about that. So surgery went well, and then that morning, that was Friday morning, they took out the Foley catheter, thank God. Like I said, that was my biggest problem. So took out the Foley. I was able to self-cath, and I was even able to self-cath on a bedpan. So if I can do that on a bedpan, I can do it anywhere. So I was happy to be back to normal that way. As far as my constipation, I feel like I have to go to the bathroom. I haven't gone to the bathroom yet. They tell me not to push because I don't want to add any strain to my stitches. So I'm not allowed to push. But basically what they've done is like double up on all the medication that I've taken for constipation anyway. So I take Miralax every day. I'm doubling up on that. Yesterday when I was in the hospital, they gave me Miralax, they gave me Senecot, and they gave me Colace. So pretty much feel like I've had everything. And I'm also trying to eat things that I know usually make me go to the bathroom, salads and things like that. So trying to, and I'm drinking a lot of water, a lot of cranberry juice because I still have a pretty bad UTI. Yesterday I felt like I was, peeing every 5 minutes, and you know, just having the burning sensation from the UTI, which, I've had those before. But this one's just a little bit worse. And I'm sore, but I'm just taking ibuprofen now for that. And, that's the soreness really is the least of my worries. It's more dealing with the bladder and the bowel right now that's, being more of a problem right now. So, I'm just working on that now. But I guess my biggest suggestion to you, if you have bladder and bowel issues to begin with, and you're going to have a hysterectomy, make sure that you stay hydrated before that. Maybe a few weeks before, make sure you're drinking a lot of water, and if possible, if you can self cath, try to do it that way. Talk to your doctor obviously about if they need to keep the Foley in all night or not. But like I said, I had asked for it, and I now wish I hadn't. So, um, just wanted to share that. I am feeling like I'm getting better every day. It's been 3 days now, and you know, feel pretty good today.